Are you having low libido? Let's talk about the 5 causes for low libido in women. I'm Dr. Jen, double-boarded OBGYN in integrative health. I also specialize in menopause and sexual health. So let's talk about the causes. First of all, before we talk about causes, we should really talk about what that means. So low libido is a lack of sexual desire or arousal or just overall interest or pleasure with sex. And usually this occurs for at least 6 months and is interfering with your life. It could be interfering with your relationships. It could be interfering with just your overall well-being. So in medicine, we call this hypoactive sexual desire disorder, but low libido is a term that most everybody can understand and really will come to me as a patient and saying, I just have no interest, no sex drive. So let's talk about the 5 causes. So number 1 is as we age, perimenopause and menopause causes a decline in ovarian hormones. So we have a decline in estradiol and testosterone. Both of those hormones are incredibly important for libido. They help with arousal and desire. They help with improving blood flow to the genitalia. So when you lose those things in perimenopause and menopause, then women often have a lack of desire and arousal. In fact, they could even have anorgasmia or a difficult time achieving orgasm or just frankly a lack of orgasm. So declining hormone production or aging is a very common cause of low libido, low sex drive. And that's something that hormone replacement therapy is very well known to improve sex drive or improve libido. In fact, I did a whole video on testosterone in women and also another video on Doctor's Guide to Hormone Replacement Therapy. So check those videos out. Number 2 is pain. So if you have pain during sex, it really makes it very less motivating to really want to have sex. And pain can be either maybe you've had a bad sexual experience and had pain. And so your brain is already understanding this is not a desirable outcome. Why would I want to have sex when it hurts? Or maybe something has developed that you now lack lubrication, or you maybe have no hormones in that area. And so you get burning with sex, or frankly, some women, they have pain because maybe they've been forced to have sex, even though it's painful. And so then they also have this contributing factor of knowing this is not a pleasurable activity. So if you're having pelvic pain with intercourse, and that is causing a low desire, please go seek a healthcare professional that can do a good exam to understand where is this pain coming from? Is it the vulva? Is it the vagina? Is it deep? Where is the pain coming from? Is it a lack of lubrication? Is it that the tissue is now pale and thin and the vaginal atrophy is causing problems where you have pain? So please, if you do have pelvic pain and that's contributing to your low sex drive, please get an exam by a professional that understands the changes that occur in menopause, but also understands pelvic pain. Pelvic floor therapists are fantastic too. They can often give you good insights into what is happening. Number 3, chronic medical conditions. So some medical conditions like diabetes, lupus, high blood pressure, vascular disease can actually cause less blood flow to those areas. You have less blood flow to the genitalia because blood flow in general is compromised. This is how men with erectile dysfunction, one of the most common reasons is hypertension, high blood pressure that they've developed, and they actually are not getting adequate blood flow to the penis. Same thing can happen to women. If you have chronic conditions that contribute to blood flow decreasing, then you may have less desire because you're just not getting that flow to the clitoris or to the other genitalia, and it's really affecting your sex drive. 4, anxiety and depression. So women with anxiety and depression, not only do they have just decreased interest in activities that are pleasurable, right? I mean, that's the definition of anxiety and depression. So decreased interest in things that you would normally find to be pleasurable, but also it contributes to their sleep. And so when they have difficulty sleeping, it also becomes hard to be interested in sex when you're not sleeping. You'd rather sleep than have sex. Also, the changing of the neurotransmitters, not only dopamine, which actually is the sort of the big one here, but serotonin and also GABA can contribute to what happens with desire and arousal. So if you have depression that's untreated or anxiety, it may be contributing to your low sex drive. So lastly, number 5 is medications. So some medications are known to decrease libido, some of them by decreasing the blood flow And some of them by, frankly, disrupting the neurotransmitters in the brain and therefore actually causing libido. So the common ones that people would know would be SSRIs like Paxil, Prozac, Celexa, Lexapro, hypertension medicines like beta blockers. And then there are a handful of other medications, especially birth control, which lowers testosterone, and that can also affect libido. We talked about testosterone being on number one. So if you're lowering testosterone with a birth control, you can certainly affect your libido and sex drive as well. Those are the top 5 causes for low libido in women. If you want more information about testosterone and estrogen, please check out my other 2 videos. On my next video, I'm actually going to talk about ways that you can improve your libido naturally.